So please lie on your backs. So just sensing your weight on the ground. And really tune into your breathing. Just the inhalation, the exhalation. Sensing the fullness of your lungs, expanding. The invitation to the ribs in front of you, in your sides and into your back. A couple times just imagine that you have a balloon down in your lower abdomen, kind of in your pelvis. And you might just lightly rest your hands and your fingertips on your lower abdomen, somewhere between your belly button and your pubic bone. And just as you breathe in, see if you can get a little expansion down in your belly. And as you breathe out, let it go. So you're imagining that with the inhalation, that balloon is expanding and filling your lower abdomen. And then as you exhale, it's releasing. And then you can let your hands back down. And then take your left leg, roll it out to the side, slide up on the outside edge of your left foot and bring your knee up to standing. And do the same with the right leg, sliding it out and up, bringing it up to standing. And bring your attention to your left arm. And see if you can just lightly slide your left arm downward a little bit on the floor and back upward. So it's almost as though you're reaching towards your left foot. You might roll your hand so it's palm up, upward towards the ceiling. Sliding it down, feeling your shoulder drop. Feel what happens in your head and your neck and coming back to neutral. And really listening, how far is comfortable, is easy, and is safe for my body in this moment. Feel what happens in your ribs. And then next time your arm is back to neutral, just pause for a moment in this position. And then return to that same movement, sliding your left hand downwards as if you were reaching towards your left foot. But add in the movement of pressing through your left foot. So press through your left foot. You might feel the left side of your pelvis lifting a little bit, just like in the push-through foot lesson we did. But this time you're sliding your arm down and back up. And then just rest in the middle. Let your legs down or leave them up. Just see if you can feel any influence of these first few movements on your left side compared to your right side. Your left shoulder and your right shoulder. The left side of your rib cage and the right side. The left leg and the right leg. And then interlace your fingers. And just sort of feel how you naturally bring your fingers together over your chest. Just feel how you do that. And then let them go again. Let them rest at your sides. And then just bring them together again. Good. And then this time bring your hands behind your head. Not your neck, but your head. So you're really holding on to your head. So it's underneath, so between your head and the floor. And see if you can gently slide your head a little leftward and back to the middle. So your head, actually using your hands and your arms. So you're going to move your arms, your left elbow is going to go leftward and a little downward, and then you'll come back to the middle. And see if you can tell the difference between sliding your head leftward versus rolling your head. So for this movement, we really want to try to slide. So your face will stay in the same configuration facing the ceiling. It won't roll towards one or the other wall. So sliding left and back to the middle. Feeling your left elbow going leftward and downward. And then the next time you're to the left, just stay there. Go only as far as you can go so that you can just stay leftward comfortably. And bend up your left knee, rolling it out to the side, bringing it up to standing. And see what it's like in this position to press through your left foot, lifting the left side of your pelvis and lowering that back down. Feel what happens in the ribs, pelvis, shoulders. And as you do this movement, see if it helps you slide your head and arms just a little further to the left. When you lift your pelvis up, see if a little more movement becomes available without it really being a stretch or a strain, but just sort of fun and interesting thing to do. And just seeing how far leftward you can keep your head and your arms, and if you can take them a little bit further leftward. And keep your head and arms there, let your left leg down. Just sense and feel yourself breathing in this position. Where does the breath go? Good. And then bring the arms and the head back to neutral and rest. And again, bend the left knee up. Bring your hands behind your head. And continue the movement. Press through your left foot, slide your head, elbows, arms down to the left. And just a few times do the full movement, bringing your head and arms back to neutral as you lower your pelvis back to the floor. Breathing. Feeling what happens in the ribs. As your shoulder and pelvis come towards each other on the left side and open away from each other on the right side. And again, you can make this movement just as small as you need to. You can imagine it if needed. Next time your head and elbows and arms are to the left, just keep them there and See if you can lower your pelvis back down. If you need to back off a little bit, that's okay. Lower your pelvis, keeping your head, arms, elbows to the left. Lower your left leg back down. Very gently roll your right leg out to the side and bend up your right knee. Very gently begin exploring just the lightest pressure through your right foot, lowering it back down. What's this like? Head, arms, elbows to the left, but pressing through the right foot. Lightly, gently. What's happening in the ribs, in the neck? Feel your breathing. Bring your head and your arms and elbows back to neutral. Lower your leg down if that's comfortable for you. And just feel the influence of that. Oh, let your arms down too. Yeah. Feel the breathing. Feel the lungs expanding in your chest. And again, interlace your fingers. Hands, bring them behind your head. Slide your left foot up, standing through your left foot. And play with sliding your head, elbows, and shoulders leftward, pressing through your left foot, seeing if anything's changing. Do that a few times until you can leave your head and arms and elbows to the left. And leave them to the left and stay there. Lower your left leg down and bend up your right leg. Try the movement again, pressing through your right foot, lifting the right side of your pelvis. Just very gently listening into your pelvis, your trunk, your ribs and shoulder blades. Listening to your neck. Keeping your jaw soft. Good, and then lower the right leg down, bend up the left leg. See if it's easy comfortable to bring your head and elbows a little further to the left, only if that movement's available for you. Scooch down a little further to the left and then lower your left leg down and bring your right leg up again. And let's just do a few more movements. Pressing through your right foot. When you've done 2 or 3 or so more movements on the right side, bring your head and arms back to neutral. Let your arms down and let your leg down. Just feeling into yourself. What's the breathing like now? Is it any easier to sense differences from your right and left side? And go ahead and bend up both your knees one at a time, please. And gently begin sliding your right hand, palm facing the ceiling, downward towards your right foot, and back to the middle. Just feeling the play, the movement in the ribs and the shoulders, letting your head slide. Good, and come back to the middle. Just pause for a moment. Keep your knees up. And this time I want you to interlace your fingers over your chest. And I want you to move one finger over, so we're interlacing non-habitually. And just kind of take a moment and feel into that non-habitual finger lacing. And then shift back to what's habitual. Shift back to the way that you just naturally fall in. And so you can kind of feel how that settles differently on your nervous system. And then again, shift one over the non-habitual way. And then keeping yourself in the non-habitual interlacing of your fingers, bring your fingers and hands behind your head again. And experiment with sliding your whole head to the right. Shoulders, arms, so that your arms are carrying your head as much as is possible. And back to the middle. And just exploring your way rightward in this configuration. You might start to feel just the invitation from your pelvis, from your right foot. So go ahead, when you're ready, begin pressing through your right foot, letting the right side of your pelvis lift, and shifting your head and shoulders and elbows rightward and back to the middle. Next time you're in the middle, just go ahead and rest for a moment. Let your arms down, let your legs down. Sensing into yourselves. And again, interlace your fingers non-habitually and bring them behind your head. Bend up your right knee, rolling it out to the side and sliding it up. And continue the experiment, sliding your head, your elbows, your arm rightward, lifting the right side of your pelvis. And then next time you've slid yourself leftward, just let your head and arms stay to the left and see if you can lower your pelvis down. Right, yes, to your right. Lower the pelvis down and just stay in that configuration for a few moments, just feeling the breath, the ribs. And then just a few times, try pressing through your right foot, seeing if you can slide any further to the right. But again, only if it's easy, only if it's gentle. Staying still in this configuration, lower the right leg down. Roll the left leg out to the side and slide the foot up, bending the knee and bring the knee up towards the ceiling. Standing through your left foot, very gently begin pressing through the left foot, feeling that connection to the pelvis. Letting the left side of the pelvis gently begin to lift off the floor. Feeling that through the ribs and the shoulders. Gently bring your head, your arms back to neutral. Lower your arms down, lower your leg down. Interlace your hands. You can interlace them habitually or non-habitually and bring them behind your head. Bend your right knee up. Begin sliding your head and arms and hands towards the right. And lengthen your left arm upward on the floor. So you're going to stay in this position, your head to the right, your right knee bent. Lengthen your left arm upward. So, and best as you can, have it resting on the floor. So if it can't be completely overhead, it can be slightly out to the side if needed. Try to have it feel supported by the floor. And then continue the movement, gently pressing through your right foot, and see if you can begin to look towards your left hand. So it's almost as though your right hand is helping your head turn a little bit towards your left hand. Like you're just going to look upward. And again, really listening, making sure this is a position that's possible for your spine and your neck and your head. Just feeling the possibility of that arch in your whole spine. And sometimes in some of these movements, our imagination, when used, can be a wonderful asset. If you find yourself not being able to do certain things, it's really backing off and imagining. Because usually you'll imagine yourself doing it more smoothly than if you were actually doing it. And remember what I said earlier, the brain doesn't know the difference between actually doing something and imagining it. So if you can imagine a smooth, easy, soft movement, pressing through the right foot, looking upward towards the left hand, you're still making connections in your brain. And lower your left arm down, bring your head and arm to the middle, lower everything down, arms to your side, legs down if that's comfortable for you. You can keep them bent up if that's better. And just feeling into yourself. Interlace your fingers, please. Bring them behind your head. This time roll your left leg out to the side to bend your knee up and come to standing through your left foot. And begin pressing through your left foot and bringing your head and elbows leftward, just like we did in the beginning. And just do that movement a few times. Feel yourself going back and forth comfortably, as lightly as possible. And next time when your head and arms are leftward, just stay there. Lower your pelvis down. Feel yourself breathing in this configuration. Go ahead and lower your left leg down and roll your right leg up. Bending your knee, standing through your right foot, and a few times pressing through your right foot in this position. Lower your right leg back down. Bend your left knee up. And just see if it's at all easy, effortless to press through your left foot and lower your head and elbows leftward anymore. And really listening to yourself. Lowering your pelvis down. And then reaching upward on the floor with your right arm. So finding a place somewhat overhead, but it could be out to the side for your right arm to rest on the floor. Keep it to the right of midline though, so it's not up and over your head so far that it's starting to go leftward. And then continue pressing through the left foot and just begin that gentle possibility of looking towards your right hand. What happens in your neck, your ribs, and your head? That possibility of looking upward. Notice if you're clenching anywhere in your teeth or your face. You're holding your breath. Just keep the movement fluid and soft. Lower your right arm down, bring your head back to neutral. Lower both arms down, both legs, take a full rest. Sense your right arm and your left arm, right leg and your left leg. Sense the lungs inside the ribs, the breath filling the lungs, expanding the ribs. See what your sense of your ribs are in front of you, along your sides and in your back. Shift how you're attending to your breath. Shift to that image of the balloon down in your lower abdomen. Imagine as you inhale, you fill the balloon, softening your lower abdomen, allowing it to expand. And as you exhale, the balloon deflates. And just a few times, a few breaths, shift your attention, 1 or 2